Today I have a pleasure to interview Phil Krzyzek, General Manager of Healthcare Poland and Managing Director Healthcare Business of Merck. It's a great pleasure to have you here.
Thank you. It's a pleasure to be here.
Let's start with the first question. Many Polish families will be dreaming of becoming parents in 2024. In vitro is an important area of Merck. How do you see Merck's role in Poland and in new social-political situation, which is favorable to promote parenthood with in vitro support?
Yeah, well, firstly, I think obviously, we warmly welcome the decision to once again reimburse IVF procedures. Look, I know from my own experience and some of my family members how incredibly emotional and difficult it can be when people are facing infertility problems. And, it is many people's dream, to have children. And, when you're faced with the prospect that might not happen, obviously, to have other options available to you to help you to have a family is invaluable. So obviously the impact on individuals in Poland and the opportunity is really great to see. But I think the other thing is that declining birth rate is a problem in many countries and also in Poland. The World Health Organization recognizes infertility as a civilization disease. And actually, it's more common than people realize. 15 to 20% of couples of childbearing age can experience infertility problems. So, this also has a big impact on society as a whole. From Merck's perspective, we have been absolutely critical as part of the IVF procedures for some time now. So, we've got a long history of supporting IVF, and when it comes to the situation in Poland, we're very much ready to be available to support and to help and to ensure we're a reliable partner, in this period of time. So I think it's extremely good news. I think there's a lot that can be done in collaboration because the IVF journey is not an easy one, and it does require, I suppose, everybody collaborating together to bring these dreams come true for people.
And how you describe Merck's involvement in fulfilling parents' dreams of parenthood in Poland and worldwide?
Okay, well, Merck is actually it's the oldest pharmaceutical company in the world. So it's over 350 years old, and our journey in fertility started over 100 years ago. So the origins, date back to 1906, and we were actually the first company to provide hormonal treatment back in the 50s. But we've continued to research and evolve over that time period. We were the first company to produce recombinant treatments, which are, again, a step forward in treatment. And in fact, we produce a number of medicines which support the whole IVF journey, from the beginning to the end. And I would say, we were involved in the very first birth back in the UK in Bourne Hall in 1978, the very first IVF birth, and since then we've probably contributed to somewhere like 50% of all the IVF births that there have been, and which accounts for about 5 million babies to date. So obviously, it's a very important area for Merck and something that we've been highly invested in, and we will continue, to push the research boundaries because there is still work to be done. Obviously, IVF is much more successful than it used to be, but we need new treatments, we need improved treatments, and we're at the forefront of that with our partners and our IVF experts. But I think it's important to say that it's not just about supplying medicines. The reason being is and perhaps we'll talk later, you know, the IVF treatment process is extremely complex, and there are a number of factors that influence the success rate. And one of those is the sort of psychological aspects of treatment, and we're very interested in making sure we support patients with that. But also, you know, we still need to make sure that patients have full access to treatment. Now, obviously in Poland, this is a big change in the country, but, you know, I'm not just talking about government policy. Access also involves education of the population, so people understand IVF and they feel that it's something that might be appropriate for them. So, you know, I've mentioned the sort of the emotional burden, but there's a big financial burden on families as well, and also, you know, a time burden. And actually, Merck just recently we launched a fertility benefit for our employees. It's coming soon to Merck as well, and this is going to help employees with the financial burden, but also, you know, the work-life balance. And I think it's, you know, obviously it's very important for a company like Merck to also be supporting our employees in that respect.
Mm-hmm. It sounds very complicated, and probably it is, but what is the biggest challenge for you when it comes to infertility treatment? Can you point some problems? Yeah.
Yes, it's well, look, the first thing to say is that obviously, you know, we're very much involved in the science, and we're very much committed to ethical approaches to the business side of IVF as well. And, you know, I think it's fair to say we've built up significant trust with the IVF community through our approach to research and our support of treatment, our results, our transparency, etc. And I think that's the first thing. I think if you're involved in this area, it's very important to, you know, to have the highest ethical standards and quality. But when we think about the whole process of IVF treatment, even from a research perspective, it's really complex because it's a multi-stage process. The IVF journey can look very different clinic by clinic because, you know, there may be different practices. So when it comes to research, sometimes it can be very difficult to get a large enough and homogeneous enough sample sizes so that you can demonstrate, if you like, the effect of any particular medication or other type of intervention. So I think that there's a research challenge there. And obviously, you know, I talked about the variety of situations. You know, different clinics may have slightly different processes, but patient profiles themselves can vary significantly. Okay, so, and I'm not just talking about age. You know, age is one of the probably the most significant factor. Okay, and if you look at the success rates of IVF, you know, below the age of 35, you're probably looking at about 40 to 45% success rate per cycle of IVF. But once you get up to the age of 40, 41, 42, you know, that can drop to 10 to 15%. Okay, so age is a very important factor here. And clearly, as I mentioned earlier, we do need to continue research and we do need to improve on those success rates. But what are the other things that affect success rate? Well, first of all, I talked about access and people's knowledge and understanding of IVF. And I think probably it's particularly important in Poland as well that, you know, the population understands the science behind IVF, what's involved, and perhaps, you know, let's make sure that we remove any taboos, because sometimes it can be, you know, it's something that when you experience IVF problems, when you experience infertility problems rather, it's not something you want to talk about immediately, you know, and it's something that, you know, you need a supportive environment. And I'm talking about your family, your friends, but also society in general. So I think, you know, that's one of the things that complicates treatment is people's understanding, their readiness, and their willingness to approach treatment. The other area, and I've mentioned it already, is the psychological and emotional burden. You know, it's very devastating, I think, when you first admit that, yes, maybe there are infertility problems, but then the whole process of IVF can be really bewildering, okay? Because obviously the process itself is demanding, but then you've always got this feeling of, well, how successful is it going to be? What expectations should I set for myself? Often, cycles fail, okay? And that can be a really huge impact on someone's emotional well-being. And often it's true that, I mentioned affordability is one thing, and obviously reimbursing the procedures is a fantastic move forwards. But actually, one of the other reasons people, stop doing cycles is because of the emotional burden, and they stop probably sometimes too early because, many couples need several cycles in order to be successful. So I think supporting, the emotional journey is almost as equally important as the science and the treatment. And I think the last area is just logistics. Okay, when you begin IVF, there's a lot involved. There's a lot of time involved. You may or may not be comfortable to tell your employer what's happening with you, but there's time that you need to take away from work. You need to get the right balance, because that journey is it's just cumbersome in terms of appointments, in terms of tests, in terms of everything else that's happening. You also need to adjust your life to cope with the procedure. So, as I said, it's a very complex and demanding area, which is why collaboration between, pharmaceutical companies, doctors, patient groups, etc., is really important, so that we can together, improve success rates for patients.
Yes, you mentioned about a supportive environment. So let's zoom into Polish environment. And was the Polish skepticism of in vitro was a surprise for you when you came to Poland?
I was aware, of some of the topics. I'm half Polish myself, so I'm aware of some of the ethical and religious considerations. I think it was surprising to me that I suppose the overall lack of support for IVF. And apart from the sort of let's call it more political issues, just from the point of view of benefit to society, we know that the growth rate of the population in Poland has reduced, and also the fertility rate is reducing. So I think, in that context as well, I felt it was surprising that IVF wasn't being made available more widely. But I know it's a complex issue, and as I say, I think all of the considerations are important, but it's about choice, and I think giving patients that choice of whether they want to start that journey or not is the important thing.
Well, a lot of issues are going on around the world right now, a lot of problems, difficulties. How does the unstable geopolitical situation impact Merck? Can you describe it or give them some answers?
Yes, well, obviously Merck is a multinational company, okay? So anything that happens on the global stage can have several impacts. We operate in over 140 countries worldwide. And obviously, from a supply chain point of view, any disruption, any political instability or conflict, sanctions, etc., can affect our ability to export and import both raw materials and products. So, it can make it difficult for us, and this can lead to delays, and it can lead to supply issues. However, what I would say is that throughout that period, we have been extremely successful in maintaining our supply. We've made lots of alterations ourselves and de-risked our supply chains, so that we can continue to be a reliable and consistent supplier, especially in the field of IVF. I think the other thing is that obviously political and geopolitical turmoil can affect economies, and it can affect people's confidence, and therefore, perhaps this can reduce, if you like, the number of people coming forward for IVF. dependent on the country's situation. And lastly, I would say, international collaborations on science in IVF are extremely important. And obviously, any sort of geopolitical tensions can disrupt that. And that's not a good thing. So, we want to continue to collaborate for the benefit of patients and to drive up success rates. So, yeah, I think, obviously we would all like more stability. But I think by being proactive, by managing the risks, by having a diversified strategy, we're able to cope with those situations. And as I say, we have maintained our reliability throughout that period.
Mm-hmm. Well, Polish healthcare system is not perfect, like nowhere else. Nowhere is perfect healthcare system worldwide. But what do you wish for the Polish healthcare system right now?
Yeah, I think I wish for the Polish healthcare system the same as I would for any healthcare system, okay, which is, appropriate level of funding for healthcare and, sustainable, stable funding as well. And that's important because not only am I talking about from the point of view of, access to medication, but I'm also talking about infrastructure, manpower, enough doctors and nurses. And I think, this is obviously important for individual people in Poland, but it's also important for the country as a whole. Yeah, a healthy healthcare system means we are a stronger, more competent country in general. So it's actually, for me, a strategic issue as well. So I think that, adequate and sufficient, stable funding is important. I think the other area is all healthcare systems sometimes can forget that they're serving the patient. And I think systems and processes need to be designed with the patient in mind. Okay, so people talk a lot about patient-centered care. Okay, and this ranges everything from individualized treatment, which obviously is a big growth area from a technology point of view, but it also means how the system adapts to make sure that actually the patient journey is the best possible patient journey. So I think a more patient-focused healthcare system is got to be a good thing. And often, and there's plenty of examples of this, the more patient-centered you are, actually, the more cost-effective and productive the healthcare system is. So I think that's another important area. But obviously, prevention surely must be a valuable thing to do to help, reduce healthcare burden in general. And I think, Poland is not on its own in terms of the percentage of spend on preventative healthcare. Many countries would like to spend more on that. And I think that has got to be a good thing. More preventative medicine, more preventative public health policies to reduce the burden and really, prevent disease where it's possible. I mean, that's obvious. The last thing I think is, and I think this is an enabler, okay, because all governments, all societies struggle to provide, the right level of healthcare from a spend point of view and from a productivity point of view. But one of the things I think that is underutilized is partnership. Okay, so partnership between healthcare organizations, between healthcare organizations and industry, between healthcare organizations, industry and patient groups. I think there's a lot that can be achieved by partnership. And, Merck, ourselves in Poland, we have a partnership with the Warsaw Health Innovation Hub. We're involved, obviously, not just in IVF, but also heavily involved in oncology. And, we've got some really good examples of how we are partnering to look at the patient pathway in oncology to improve diagnosis, to improve time to treatment, and ultimately to improve treatment itself. So, I think that's an untapped resource, let's say, is the partnership and the outcomes that can be achieved from that. And I'd like to see more of that.
Phil Krzyzek, General Manager Healthcare Poland and Managing Director Healthcare Business of Merck. Thank you very much for your time.
Oh, it's a real pleasure. Thank you very much.